Okay, watch. The heart is unique. The heart is unique. And the reason it's unique is it has two features only found in heart muscle cells, at least in this class. Number one, you have gap junctions. And gap junctions are literally tunnels between individual heart cells. So what gap junctions do is they allow heart cells to communicate electrically. So gap junctions are tunnels between heart cells that allow the instantaneous spread of electrolytes from one heart cell to the next. Now, why is that important? It's important because when your heart contracts, you want the atria to contract as a unit, and then you want the ventricles to contract as a unit. Do you follow that? So gap junctions electrically connect all the heart cells together. So when one heart cell, in this case an atrial heart cell, produces an electrical impulse, it will instantly spread over all of the atrial cells, so that even though the atria are made of gazillions and gazillions of different individual cells, the atria electrically function as a unit. Do you got that? The other feature that are found in heart cells are these things called intercalated discs. And these intercalated discs tie individual heart cells together. They tie them together. So think of people on a tug of war, right? They're tied together by the rope, and even though they're individual people, they're pulling together. You got me? So intercalated discs, that's a good word. I always think of a coffee pot, a percolated disc. Intercalated discs tie mechanically individual heart cells together. So when they contract as a unit. Those are the two things that allow heart cells to function as a unit. Tell me you're with me, you're following this. Okay. Now, there are heart cells. Write this down now, very important. There are heart cells that do not contract, but instead they produce electrical impulses. And they're spontaneous. So specialized cells within the heart itself, specialized heart cells, they don't contract. What they do is they produce electrical impulses. And you better write this down, better not pout. I'm telling you why. I forgot what I was going to say.
Produce electrical impulses.
Right. So these specialized heart cells do not require nerves to stimulate the heart to make it contract. It is a natural, intrinsic, inborn electrical conduction system. Listen up, because again, this is true. The peripheral nervous system, the autonomic nervous system, parasympathetic and sympathetic, they can augment heart function. But if you were to rip somebody's heart out of their chest, that happened to me when I was 24. I was dating this girl, man, and then she just left me. Yeah, I cried for about a week. And I got over it. I think. Anyways. Can I tell you this story real quick? Oh, just quick. I was in graduate school down in Chicago. So my buddy that I just went golfing with yesterday in Chata 82, I'm really digressing, but here we go. He knocks on my apartment door, the back door, right? I open it up and he's crying. So I ask him the 3 questions that would make me cry. Your mom died, your dad died, you got cancer, right? He goes, she left me. I go, what? My girlfriend left me. You know what I did? I grabbed him by the shirt and I slapped him right across the face. I said, wake up. That's the best thing that ever happened to you, right? I said, I'm going to jump in the fire and we're going to go out and chase some women. right? Anyways, real quick. 15 years ago, we're at Maple Crest Golf Course, and he says to me, "Hey, Tim, remember when I came over to your place and I was boo-hooing, and you slapped me across the face?" And I go, "Yeah." He goes, "That was the nicest thing anyone ever did for me." Okay, here we go. Are you ready? They do not require nerves to make the heart contract. Now watch. Listen up. Watch. Watch. If you rip somebody's heart out of their chest, it will beat spontaneously because of that natural intrinsic cells that produce the heart rhythm. That's why you can transplant somebody's heart. If it required nerves from the brain and spinal cord, in order to transplant somebody's heart, you would need to rip out their brain and spinal cord along with their heart and then transplant it into a new person. And then you would have a different person. And it might be a person who doesn't read the textbook, Dominique. Tell me.
I have a question on that. They don't require nerves. Why? Because they have some.
Because these specialized cells are able to produce on their own these electrical impulses. And you better write this down, better not pout. Collectively, these cells that produce the electrical activity of the heart make up the electrical conduction system of the heart. Are you with me?
Are these the nodes we're talking about?
Yeah.
Okay.
Ready? So watch. Watch. Which do you want to contract first, the atria or the ventricles?
Atria.
You want the atria to contract first, right? So separating the atria from the ventricles is this fibrous non-electrical conducting ring, the Furbenacker, right? This fibrous non-electrical conducting ring electrically insulates the atria from the ventricle. Tell me you got that. So when the cells of the atria fire, they can't go directly to the ventricle, and you don't want that. You want the atria to contract first to push that additional blood into the ventricle. Say yes. So here we go. The pacemaker of the heart, the normal pacemaker of the heart, is called the sinoatrial node, or SA node. And when the SA node produces an electrical impulse due to gap junctions and intercalated discs, that electrical impulse travels instantly over both the atria. Who's following me so far? And if you have somebody hooked up to a EKG machine, on the EKG, it produces this little wave called the P wave. So the P wave represents atrial depolarization. Atrial depolarization is a fancy way of saying the electrical impulse in the SA node fired, and it sent those electrical impulses instantly over the atria. Say yes. And the reason it's called a P wave is because it has a P in front of that wave. That's a P wave. All right, now watch. To guarantee that the atria contract before the ventricles, you have the fibrous non-electrical conducting ring. Who's with me so far? So all of those impulses that were created by the SA node, they have to get to the ventricles. So all of those impulses created by the SA node are funneled into the next portion of the electrical conduction system called the AV node. AV node, atrial ventricular node. And in that AV node, there's a little delay. I am exaggerating this delay for the point of edification. Nothing? Okay. So flat line over time, no electrical activity. So once the delay is over, that electrical impulse travels through the next portion of the electrical conduction system called the bundle of His, or the AV bundle. And the AV bundle electrically connects the AV node ultimately to the ventricles. And watch. The bundle of His will then branch into the left bundle branch. Who's with me? And the right bundle branch. The left bundle branch supplies electrical stimulation to the left side of the heart, the left ventricle, and the right bundle branch provides electrical stimulation to the right ventricle. And then as you can see, it further bifurcates and fasciculates. I'm killing it today. Matriculate, yeah? Watch. Into smaller fibers called Purkinje fibers. That's a good name. Anyone willing to change their name to that? Purkinje fibers? Purkinje fibers, clean up your room. Got me? All right. And then, watch. I want this. As that electrical impulse goes through the bundle of His, the left and right bundle branch simultaneously, and then the Purkinje fibers of both the right and left ventricle, it will produce on the EKG the QRS complex. So the QRS complex represents the electrical impulse traveling through the bundle of His, the right and left bundle branches, and the Purkinje fibers. Say yes. And it's called QRS because this was the P wave, and then what's after P? Q. Are you writing that down? What did I learn today in class? Q comes after P. And the QRS complex represents ventricular depolarization. Both the right and left ventricle depolarizing at the same time. Who's following this? Guys? Now, what's your hope? What's your hope? Your hope is that you have more than one heartbeat each day. Nina, do you want more than one heartbeat each day? She is in acknowledgement of that. That's a good thing. So what you have to do is in the ventricles, you have to reset the electrolytes so that they will do it all over again. And when you reset the electrolytes in the ventricles, you produce the next wave on the EKG called the T wave. The T wave represents ventricular repolarization. It represents the electrolytes resetting so that you can do it all over again. Who's following this? Guys? All right, now watch. Write this down. Anybody got an umbrella? You do? Sweet. Let me use that in a minute. Yeah. Oh, is it really? Well, you can open it. Evelyn, you want to open it? Okay. All right, so watch. Write this down. The first part of the ventricles to depolarize is the intraventricular septum, that piece of muscle that separates the right and the left ventricle. The first part of the ventricles to depolarize is the intraventricular septum, and it's depolarized by the left bundle branch block, or left bundle. And you better write this down, and I'm going to draw it real good so you can see it. I'm going to use green. That's my favorite color. It always depolarizes left to right. Left to right. The intraventricular septum depolarizes left to right. What depolarizes the intraventricular septum? Get this right, give you a vertebrae. The left bundle. Say yeah. Left to right, very important that you get that. Then, once the intraventricular septum is depolarized, it will spread over the left and right ventricles. So it depolarizes, you better get this, apex to base. Base, widest part of any organ, apex, the narrowest part. So even though the apex of the heart is on the bottom. So it depolarizes the ventricles. Here's the apex, like this. Those electrical impulses spread like this. Like this. You better write that down. Endocardium to epi. Endo to epi. Inside to out. And apex to base. This is critical. If you're ever going to understand the electrical conduction system in the heart and what an EKG looks at, you have to understand what I just laid on you. What's the first part of the ventricle to depolarize? The intraventricular septum. How does it depolarize?
From left to right.
Left to right. Then the right and left ventricle depolarize at the same time from apex to base and endo to epi. Say yeah. So watch. Where's that umbrella? I'm opening it up. If you throw a highlighter over your right shoulder, it breaks that curve. Where? Oh, right here? Yeah, it says button open. Okay, watch. Imagine these are the right and left ventricle, and this is the intraventricular septum. You got me? When the ventricles contract, they go down. Oh, that don't help me. Well, it sort of works. Man, this is heavy. Okay, watch. It goes like this. Right and left ventricle, intraventricular septum. The first part of the ventricles to contract is the septum. The septum contracts upwards. And what it will do is it will pull the apex of the heart upwards. Tell me you got that. So as the intraventricular septum is contracting, it's going to pull the apex of both the right and left ventricle upward. Where are the big vessels that the right and left ventricle got to shoot the blood into? They're up top. So it makes perfect sense that that would happen. Say yeah. And just so you know, write this down. If your intraventricular septum don't contract, oh, you die. So do you want your intraventricular septum to contract? Yes, every day. How do you close it?
Just put your hand on the, here, give it to me. I get bad luck of printing.
You have bad luck?
Huh?
Okay. If you find a little kid and you rub their head, they have to have a toe head though. They have to have dark hair, roots, and blonde hair. Then it'll break it. Tell me, guys, tell me you got that. Who's with me? Yep, yes or no? That's the electrical conduction system of the heart. Tell me you got it. For real? Yeah or no? All right, so we're going to go downstairs. I'm going to get Mike to come and help us because I don't know how to run the machine. I can hook you up, but I don't know how to run the machine. And then listen up. Thursday after class, if you want to get a 12 lead done, then I'll do it for you. All right? Just charge you like, $60. Is that okay? If you want one, I'll do it. I'll show you how to prep so you can prep yourself. That way, there's some law against touching students. There has to be like a 10-foot buffer zone between students. That's why a lot of times I just throw the test. Okay, who's going to videotape that? Are you going to videotape that? And then you can email it to me? Okay, here we go. Okay? All right, let me show you this. Doesn't it look like a pea stain? Okay, look. Watch. Who's watching? If you look, I'm gonna look at V2 here. Right? You with me? V2. If I draw a line, a straight line, boy, that's not very straight. This is what's referred to as the baseline of the EKG. Do you understand? So if you look here in V3, right? Here's the baseline. Do you follow that? So everything, all of the EKG and all of the deflections are read off the baseline. And now watch, anything that is above the baseline is a positive deflection. And anything below the baseline is a negative deflection. Say yeah. And if it's on the baseline, it's on the baseline.
You're dead, no?
What's that?
You're dead, no? That's what they put in movies when they're lying.
Or if they're flatlined, you got no electrical activity, yeah, you're dead. My argument has been that they say, like, if you're flatlined, then you're critical or you're unstable. At no other time in your life are you more stable than when you are dead. Let's be honest. Okay, so how many people followed that, what I explained to you? All right, so watch. Now I'm going to explain to you why they call it the QRS complex. So let's look. You probably don't got one. Oh, here we go. It's not the best, but if you look here
No,
in
we're
the,
not seeing
in the lower lead, right here, you see this little tiny negative deflection? Any time in the QRS complex, the first deflection goes below the baseline, it's a Q. Tell me you got that. So let me show you. Look here. All right, I'm gonna draw this. So here's the baseline. You got me? Then you got the P wave. Then you're going to see a little delay. I'm exaggerating. And then if the first deflection in the QRS complex goes below the baseline, it's a Q wave. You got me? If it goes above the baseline, it's an R wave. And if it comes back below the baseline, it's an S wave. Who's following me? So watch. Do you know how when you go to CVS, where's your Kleenex? Right? You just want tissues. We said, where's your Kleenex? So they generically describe this as a QRS complex, but not all ventricular depolarization complexes have a Q, an R, and an S. But they just call it QR, say yeah. All right. This is what I want to point out. This is important. Right after the depolarization of the ventricles, there's a little bit of a delay. That's not good. Who's watching this? You have this little bit of delay, and then you have the T wave. Are you following me? This little segment after the QRS complex and before the T wave is called the ST segment. ST segment. Listen up, because this is true. The ST segment is very sensitive to changes in blood flow, oxygen flow to the heart muscle. And if that thing starts dropping below the baseline, that means the heart muscle is lacking blood flow. Listen up, because you're going to need to know this at some point in your life.
The ST segment is sensitive to oxygen change.
Right. So lack of blood flow to that part of the heart initially, if the heart muscle is lacking blood flow, the ST segment begins to drop below the baseline. It's called ST segment depression. And it's treated with counseling. Do you understand that? That means that the heart muscle is lacking blood flow. Say yeah. And what's the term for lacking blood flow? No, lacking blood, that's lacking oxygen. What's lacking blood flow? Come on, get it right. Give you $1. Wait. Yeah, I think I have $1. Nothing? It's called ischemia. Ischemia, yeah. Tell me you got that. Hypoxia, lack of oxygen. Ischemia, lack of blood flow.
When someone had like the event that goes to the floor and had like that they have leukemia in their brain.
Yes. Yeah, it's called a transient ischemic attack. You've heard of that? Like a little mini stroke. You've heard of that? So lack of blood flow to the brain, temporarily cut off, then they'll act goofy, and then blood flow is reestablished naturally. They're okay. You've heard of this. So this is important. What you're looking at on an EKG, one of the things that doctors are looking at is whether or not the coronary arteries are supplying oxygenated blood to the heart muscle correctly. Yes or no?
Can you repeat that one more time?
Yes or no? What did I say?
The doctors look at.
Oh, when doctors look at an EKG, what it can tell them is whether or not the coronary arteries are providing adequate blood flow to the heart muscle, the myocardium. Tell me you got that. Guys? All right. I'm going to leave that there. Listen up, because this is true. I try to do it every year. I haven't done it in the last, I think, 2 years, but this year I'm going to do it. I teach a 12-lead EKG class, right? And it's going to be 3 weeks at the end of August, right before at the end of the semester, and then right before school starts. And I will teach you how to read a 12-lead EKG in 3 weeks. You got me? So you'll be able to read a 12-lead EKG, Nina, with one eye tied behind your back. Not even kidding. Say, and it's free, by the way. Yeah. Just once a week. Yeah. It's going to be the end of August. So what you're going to have to do is while you're in the class. So at the end of the semester, I'll give you dates. And it's in, I'll hold it here, right? And I'll teach you how to read a 12-lead EKG, right? It's a huge, that's a huge skill, right? But watch. I didn't understand this stuff until somebody explained it to me. Dr. Jeffrey Lakier, when he explained it to me, I'm like, that makes sense. He goes, I know it does. And he taught me how to read a 12-lead in 2 hours.
What is a 12 lead?
So 12-lead EKG is, look, count the number of leads. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It's 12 different pictures of the heart. Say yeah. The reason you only put 10 electrodes, you were counting, weren't you?
Yeah, that's what I was a little...
Okay. 10 electrodes, 2 of the leads, AVF and AVL, are and AVR are actually generated by the computer itself. So that's why you don't get actual 12 electrodes. You only have 10 electrodes. And one's a ground.
I got one when I was younger, and the incubator they have, instead of having the tape, it's something like suction.
Yeah, suction cups. Yeah, they use that too. They go away from those suction cups because a lot of people were stealing them because they're into just weird stuff.
What suction cups?
They used to have suction cups for the leads, so you push on it, put it on the skin, and then it would suck onto the skin.
It gives you bruises.
Yeah, and people were taking them. Think I'm lying? Right? How many people got that? I know. That's what happens when you don't read the textbook, right? You just fall into all kinds of a mess.
Yeah, I bet.
What's that?
And they wanted to try it at home.
I'm sure they did.
I told you about the guy that came in with the giant dildo in his butt.
No.
I never told you that story? This is a true story.
You just tell us what you Boris wants to tell us this one.
Could you tell us?
I'm working down in the ER in Dallas, right? So this is no joke. This guy comes in, and he's on his hands and knees, and he's draped with a blanket, and there's something sticking out. So they bring him into the room, and I lift it up, and it is a giant white vibrator. The thing had to be that long.
How did he get there? Like,
I don't know, and I didn't even ask. But he couldn't get it out, obviously. So I work with this doctor. His name was Dr. Tragus. This is your Tragus. That's how I remember that. And he had this real thick southern drawl. So he looks at it, he sees it, and then he goes up to the guy's head like this, looks at him, comes back, then comes back up, and he looks at him and he goes, "Sir, did you want me to remove it or just change the batteries?" And I always remember the way he said batteries, right? That's a true story. So what we had to do is we had to put him out, right? Give him Valium, and then pull that thing out. And it caused a rectal prolapse. So his rectum started, like, you ever see the little monkeys with the red butts?
Yeah.
That's what he looked like.
I had that once a patient just had a deodorant bottle inside
A
her.
rectal prolapse, like his
Front.
rectum start coming
Yeah.
out.
Vagina.
It looked right. It looked like a little monkey butt.
Oh,
That's because he was like holding it in.
Yeah.
Why couldn't he just relax?
well, they put it
When you
out.
got something like that, who could relax? I mean, let's be real.
And they put him
Well,
out
I'd be
in the
embarrassed. I
hospital.
wouldn't want to go to the doctor.
Watch. When things ain't working, you don't care, right? You're in trouble. But yeah, I couldn't believe that, and it was white. I always remember that. Looked like a giant freaking rocket. They turned it off though, but apparently the thing vibrated. I'm not making that up. I told you about the guy who stuck a light bulb up his butt.
That's like way too common.
A light bulb. So the end is sticking out, right? He stuck the bulb portion in it.
Glass. He stuck
Yeah.
glass in it.
Why?
It shattered.
No, we were able to get that thing out.
Really?
Yeah.
What could that happen if that breaks inside?
It could cut him up and bleed to death.
Yeah.
Look, those are people who don't read the textbook, clearly. They got way too much time on their hands if they're thinking about something like that.
There was some lady that went into the ER at my sister work, and they used to have this deodorant with a great big
My mom had one who was an ER
tickle.
once,
It's called
and they
tickle.
had the deodorant inside.
Okay, enough of that slop, right? You guys get off track, it's not even funny. It's so sad. People got sad lives. They should be reading a textbook, studying EKGs. What are they doing? Sticking a giant white dildo. I mean, who thinks of that stuff? And then who manufactures it? Like, I can imagine okay, guys, today we're making giant white dildos that vibrate. Make sure who does quality on that stuff, too? You have, like, dummies. All right, enough. All right, here we go. I'm going to explain to you why knowing this stuff is important. All right, just get that thought out of your head and focus, okay? All right. Okay, I'm going to explain to you why this is important, right? I explained to you the electrical conduction system of the heart, correct? Are those heart cells living cells?
Yes.
Do they need blood and oxygen in order to make ATP?
Yes.
Where do they get it from? That's very good, because how did you know that? I had a heart animation with the coronary arteries, right? That's very good. And how many coronary arteries do you have? Who said it? Say it real loud. You're right. Two big ones. Say yeah. A right and a left main coronary artery. You got me? Now, this is important that you get this. I'm going to write this. I'm not writing it down. You write it down. The openings to the coronary arteries originate at the base of the aorta. So the openings where blood flows into the coronary arteries, the openings to these coronary arteries are right at the base of the aorta. What kind of blood is pumped into the aorta? Oxygenated blood, right? So here is the left ventricle. Here's the left ventricle. In order for oxygenated blood to get to the cells of the body, the left ventricle has to contract, say yeah. And when it does that, it's going to open up the leaflets of the aortic valve. Observe. Hang on. Observe it. Do you remember this? It's going to get a little more complicated. Not really. Okay, watch. Left ventricle is going to contract. It's going to force open what appears to be a 1950s brassiere. I hate meat too. So watch. And the leaflets are going to block the openings to the coronary arteries. So during ventricular systole, when the cells of the body are getting oxygenated blood, is any oxygenated blood flowing through the coronary arteries? No. But what are the two things the heart muscle could do? Contract and relax. So when the left ventricle relaxes, I want this. When the left ventricle relaxes, it's going to cause backflow pressure of blood in the aorta. Right? Watch. When the left ventricle relaxes, that oxygenated blood that's in the aorta will snap the aortic valve closed, and then it will feed the blood through the coronary arteries. So watch. And I know what you like to do, and I'm not going to let you do it. I'm going to say this, I'm going to make the statement, and then I'm going to explain it to you, because I already did, by the way. The coronary arteries and the heart muscle itself, the myocardium, receives its oxygenated blood when the left ventricle is relaxed, or during ventricular diastole. Now, if you write, the heart muscle receives its blood during ventricular diastole, I will mark your whole life wrong. You're going to explain why it receives its blood flow. Say yes. Yes or no?
Yes.
Now, watch. How many people got that? Guys, yes or no? How many people followed that? All right. Watch. Hang on, where is it? There's a little coronary artery. Now we're going to look inside. Hey, there's Egbert. Are you ready? I'm going to explain to you now the pathophysiology of coronary artery disease. On your quiz, it's the pathophysiology of CAD. CAD stands for coronary artery disease. How many people here have plaque, cholesterol buildup in their coronary arteries? How many people do? Everyone does. Yeah, you got cholesterol? Yeah, there's cholesterol in peaches too, just so you know. Go ahead, get that peach juice all over the place and I get fired. You'll rue the day. Here we go. Write this down. Write this down. Arterial blood flows in a laminar fashion. What does laminar mean? Layers. You got me? Watch. And normally, the watery part of the blood, the plasma flows on the outside of the vessel, and the formed elements flow on the inside. So you got your red blood cells, white blood cells, platelets, all that stuff. Are you with me? Are there steering wheels on red blood cells? You ever see a red blood cell take a corner? So watch. Listen up, because this is true. The vast majority of buildup of cholesterol inside a coronary artery it occurs where coronary arteries split, where they bifurcate. Are you following? Fork in the road. Got me? I like saying bifurcate. Makes me feel good about myself. All right, so watch. I'm a red blood cell, and I'm going through a coronary artery, and that coronary artery is pretty straight, but then I have to take a fork in the road. Are you with me? In order to do that, I got to bounce against the wall in order to change direction. Do you follow that? Anytime you start bouncing red blood cells into the inner lining of the coronary artery, you can damage it. And listen up, because this is true. Damage to the inside of the coronary artery, it will cause cholesterol to start building up in that artery. And the cholesterol that builds up inside that artery is the bad cholesterol called LDL, lousy cholesterol. Say yeah. And over time, what happens is that you will start building up more and more cholesterol inside that coronary artery. How many people have ever been on a highway, 4-lane highway, and then it says 2 right lanes and 1 mile? Just so you know, apparently I'm the only one that can see that sign, so I get over. So what's going to happen when you get to that narrow point of the highway? What's going to happen to the cars? The cars are going to start to back up. Tell me you got that. So as this plaque of cholesterol begins to get bigger and bigger over time, the blood will begin to back up. Who's with me? And this blood will no longer flow in a laminar fashion. It will flow in a turbulent fashion. And turbulent blood flow clots. It is, in fact, the clot that kills you. Do you understand that? And you better listen up, because this is true. There's stuff in your blood. Are you writing that down? There's stuff in your blood. What did I learn in class? There's stuff in your blood. This stuff in your blood, one of the things that's in your blood, summing up, are called platelets. Platelets look like tiny plates. Just like Piglet was a little pig. Piglet, platelet. Now watch. These platelets, in order for you to form a blood clot, those platelets have to stick together. When those platelets stick together, red blood cells start accumulating. And when those red blood cells, they'll be yellow in this picture, start sticking together, you form a clot. Listen up, because this is true. The first thing that has to happen for you to form a clot is platelets start sticking together. So if you have buildup of cholesterol in your coronary arteries, do you want platelets sticking together? No. So that's why, hi, I'm Joey Bag of Donuts, and I was having a heart attack, so I got my fatty acid to CVS, and I got me some Bear aspirin. And I took me some Bear aspirin, then I got my fatty acid to the emergency room. Aspirin prevents platelets from sticking together. If they don't stick together, will they form the clot? That's why anyone who's over the age of 50 or who has known coronary artery disease takes aspirin every day. Now you know why.
How you spell platelets?
Platelets? Plate with a let.
Oh,
See, platelet, piglet. There's a little piglet over there too, if you want to look at it before you leave. There's a little baby pig. Piglet. Tell me, you guys, you got that? Yeah.
Does the cholesterol start building up where it's damaged, like where it's hitting that wall?
Yes.
Yes.
That's where the cholesterol starts building up. Do you understand that? And look, you don't see a 6-year-old bending up and picking up his marbles and having chest pain, right? This is over decades that this stuff starts accumulating. And it doesn't become a problem until later in life. Tell me you got that. And know this, you can at rest supply enough oxygenated blood to the heart muscle even if 90% of that artery is blocked with cholesterol. Tell me you got that. Now watch. When does the heart muscle receive its oxygenated blood? When does the heart muscle receive its oxygenated blood?
when the artery closes and they work with the
When is that?
when
Relax.
During ventricular diastole. So watch. Here's your heart rate. These little tick marks represent the left ventricle contracting. Where and when are the coronary arteries getting blood flow? Where? But where is this in this little picture here? Nobody's even paying attention. I should just talk to myself. What?
We're paying attention, but it's hard.
It's hard? Yeah, well, you know what, Evelyn? Life is hard, okay? Right. I had to walk to school 10 miles uphill both ways, right? And in the wintertime, you know what my mom would do? She'd make me a baked potato. And I'd keep that in my pocket to keep my hands warm. Then I ate that for lunch. So there. Here we go. Watch. If this is ventricular systole, the coronary arteries aren't getting perfused. When do they get perfused? During diastole. So if you ain't systolean, you're what?
Yes.
You're diastolean. So this period is ventricular diastole. Tell me you got that. So if a doctor suspects that they may have significant buildup of cholesterol inside their arteries, then they can't look at somebody and say, hey, you probably got heart disease. So what they want to do is they want to do a stress test. And the reason they perform a stress test is what happens to their heart rate and blood pressure when they're on a treadmill. It goes up. So watch. If your heart rate goes up, what happens to the amount of time the heart muscle is being fed?
Just goes down.
It goes down. So if you're putting greater demand on the heart and you're feeding the coronary arteries less frequently, if there is a block in that coronary artery, it will be revealed. That's why they perform a stress test. Did anyone follow that? That's why they do that. So better write this down, better not pout.
When we're like nervous or stressed and we're receiving like less time of diastole, what happens to our heart when it's receiving like less oxygen? Does it pump at the same time or?
No, what should happen is those coronary arteries should dilate so that you're sending, even though you're sending less frequently the blood, you're sending more blood because the coronary artery is dilated. Plaque is atherosclerosis. Sclerosis means hardening. So these arteries that have plaque buildup can't dilate. That's why that area of the heart lacks blood flow and it becomes ischemic. And if you take a rubber band, you wrap it around your finger, before it rots off, it will start to hurt. Anytime you lack blood flow, you get pain. So if you are lacking blood flow to the heart muscle, you get pain, chest pain. And you're not going to believe this. Watch. You're gonna learn something. I don't care if you like it or not. And it's clear you don't like it.
So arteriosclerosis, sclero means hard, artery just means artery?
Right. So it's plaque buildup and cholesterol's hard. And another reason there's calcium buildup. I'm take my pathophysiology class. Right?
So eventually we will all get
You're not getting it now?
this. No, I'm saying like.
Oh, you mean you'll get the heart disease? Yeah, you will, unless you die from something else. Yeah.
That's exciting.
Yeah, so you can just sit back in your chair and, okay, I'm just waiting for my arteries to clog. If you get clogged arteries, your carotid arteries start getting clogged, then you can get a blood clot in the carotid artery, and then you end up with a stroke. Say, yeah. That's why people with heart disease or who's had a stroke or risk factors for stroke, they're all on some type of anticoagulant because, again, it's the clot that kills you. Do you understand that?
You mentioned last class about the umbrella kind of strainer thing.
That's for a venous thrombus.
Right. Can they do that anywhere else?
No.
Or just there?
No. And I'll show you in a minute how the interventions that they use. Cutting people open, like, back in the day when I took care of them, that's becoming obsolete, right? And I'll explain how they do this stuff. I just want to show you this. Look, when you cut your finger, you cut your hand, do you have to look to see where you cut it? Do you?
No.
Why? Because you can isolate where you cut that thing almost perfectly. That's because nerves, pain nerves, sensory nerves, are very close in proximity in your skin. Your guts are innervated differently. Guts have diffuse pain fibers. That's why if somebody comes into your emergency room and says, I'm having chest pain, and you say, where is it? And they go, it's right there, right there. That's probably not cardiac related. Do you understand that? So if it's diffuse, it shoots up the jaw and down the left arm. That's serious. Tell me you got that. And they describe it as somebody like sitting on their chest because the pain fibers are much more diffuse. That's why you get chest pain. You say yeah.
Aren't the symptoms for like a heart attack different in men and women?
Yes, absolutely. The reason, now because more women are becoming cardiologists, guys, which is, oh boy, here we go again. Housewife, she's depressed. So they give them antidepressants. One of the ways that women show signs of heart disease is they will become depressed. They can't explain it. They're just like, I just don't feel right. I'm depressed. And because more women are being cardiologists, they will follow that up, and a lot of them end up having heart disease because of it. So, yeah, and all this data that I'm explaining to you and the symptoms were based on men, and was based on a Framingham study that was done in the 1960s. They followed this town of Framingham that had like 100,000 people, and they followed them for 20 years. And they found out that people with high cholesterol, smoking, drinking, swearing, not reading the textbook, had a greater risk of developing heart disease. I just want to show you this, and I'll give you a break, okay? Hang on. Watch. Anybody here ever have shingles? Okay, extra credit if you get them.
I'll pass. It's like when you have chicken pox and then you get it again, so then you get symptoms of it. They call it shingles.
Watch. Your skin is innervated with peripheral nerves called dermatomes, right? Peripheral nerves innervate specific parts of the skin. You got me? Watch. Man, I can't even see that. Here it is. T1 and T2 provide nervous innervation to your heart. Look at T1 and T2. They also provide nervous innervation to the inside of your left arm and your jaw. That's why people, when they get chest pain, it shoots up their jaw and down the inside of their left arm. Say yeah. How many people follow that? Guys? Okay. All right, take a break. All right. We can probably have the cardiovascular quiz today. 11:30. Say yeah.
Like you just explained, I was just, when I had that thing done.
Edgy. Watch. Where am I? Okay. Watch. I'm going to explain to you some of the medications that are used for CAD. Are you ready? Number one, what caused the plaque buildup? What caused that? Damage to the artery, but what started building up? LDL cholesterol. What organ manufactures cholesterol? That's right. So these people need to reduce their LDL. If you have less LDL inside your arteries, less can potentially bind and start building up that plaque. So they are given a statin. Have you ever heard of statins? Simvastatin, atorvastatin, all kinds of statins. Say yeah. And what those do is they prevent the liver from manufacturing LDL cholesterol and dumping it into the blood. All right. Number two. What is it?
Cholesterol.
Yeah, LDL cholesterol. Statins decrease it. Number two. Do you want a blood clot to form in your artery? So they're given some type of anticoagulant. And usually, in the beginning, they're given just aspirin. And then later, if it's really bad, they'll start getting more powerful anticoagulants. All right? And then number three, they're given beta blockers. And what do beta blockers block? Go ahead, say beta, I dare you. They block epinephrine, right? What does epinephrine do to your heart rate and blood pressure? It increases it, all right? So those are really the drugs that are given to manage people with heart disease. When you take my pathophysiology class, I'll explain to you more. But tell me you got that. All right, now watch. There is a concept that you need to wrap your head around called rate, pressure, product. Rate, pressure, product is an indirect measure of the amount of oxygen the myocardium, the heart muscle needs. You got me? All right, so watch. True or false? True or false? When your heart rate and blood pressure go up, your heart's working harder. True or false? True, right? So if your heart's working harder, does it require more oxygenated blood to feed it? Yes. And how do you get that oxygenated blood? I'm waiting.
From the left side of the heart.
What vessels do you feed the heart muscle?
Coronary.
The coronary arteries, right? So the coronary arteries will dilate and send more oxygenated blood to that heart muscle. Say yeah. So watch. If you have plaque buildup in your arteries, do you want your heart rate and blood pressure going up? Do you? Do you want Grandpa, who's got 90% occlusion of his left coronary artery, to be going pole vaulting? No, right? So you want to reduce the workload on the heart. And rate pressure product is heart rate times systolic blood pressure. And it determines, heart rate and systolic blood pressure determines how much oxygen your heart muscle is demanding, and therefore how much blood flow your heart muscle is demanding. Are you following this? So if you have blockages in your coronary arteries, right? You got cholesterol blocking your coronary artery. Do you want that part of the heart demanding a lot of blood flow? Do you? No. So you give them, you better write this down, beta blockers, because beta blockers block beta. Beta blockers prevent epi from binding to beta receptors. And that causes a decrease in heart rate and a decrease in systolic blood pressure. So anyone with known coronary artery disease are given beta blockers to reduce the demand, to reduce the workload on the heart. Say yeah. Anyone who's had heart disease, if they had a heart attack or they got plaque buildup in their arteries, those people are on beta blockers.
When you're in beta blockers, that works just for the heart or works everywhere?
No, most beta blockers now are cardioselective, so they only block beta receptors in the heart. Yep. So like atenolol, you've heard of that? That's a cardioselective beta blocker. Who's with me? That's rate pressure product. And understanding rate pressure product, that's an indirect measure of how much oxygen the heart muscle needs. And how much oxygen the heart muscle needs is how much blood flow it needs, because the blood carries the oxygen. Say yes. Guys? Okay.
So those people that have heart disease and they get them on the blockers and they get them on aspirin and everything, then people start taking care of themselves and eating better and exercising and all that stuff. Then does the plaque stay there?
Yes.
So it's permanent.
Yes. There's a dude, he came out 20 years ago about a plaque regression diet where you can actually regress the LDL cholesterol plaque. It was debunked. Once you got it, it's there. Right? And one of the best ways to prevent plaque formation is reading the textbook. I did a study, longitudinal, 15 years. People read the textbook, they don't get heart attacks. And they get good grades.
Someone who is like really like physically active and runs and stuff, but eats like fatty like pork chops and like food
Applesauce.
like that. Do they get the LDL cholesterol?
It really depends. A lot of this has to do with genetics.
Oh.
Do you know, you ever hear of a guy named Jim Fix? Really? You guys are young. Get old. There's a guy called Jim Fix, The Complete Book of Running. He died of a heart attack at 56, running. But what people don't know is his dad died of a heart attack at 28, and his brother died of a heart attack at 32. They have what was called familial homozygous hypercholesterolemia. Just the name should scare you.
So he did well considering.
He did. And how he was able to live that long is through watching his diet and exercising. They didn't have statins back then. And his brother's cholesterol and his dad's cholesterol were like in the 2000s. Right? If you have an LDL cholesterol of 150, right? These people were walking around with an LDL cholesterol of over 2,000. So naturally, that plaque formation was going to happen a lot quicker. And I'll tell you right now, these cardiologists, when they got the drug reps coming in for the statins, they're grabbing that stuff like they're little Tic Tacs, right? Put it in their pocket and taking it. It's a good drug. It really is. It works. It lowers the LDL cholesterol and therefore lowers your risk. But you got to start taking it young, right? It's too late for me. I'm going to have a big grabber when I'm 62. Probably in class. That'd be terrible, right? From me. Tell me you got that, guys. And remember, it's the clot that kills you. Now watch. Again, one more time. Are the cells that make up the electrical conduction system of the heart living?
Yes.
So do they need blood supply? Good. So when a person gets a blockage in their artery that supplies the cells of the electrical conduction system, watch it. A normal, nice P wave, little QRS, and a T wave turns into ventricular fibrillation. That's why, watch, the most common cause of sudden cardiac death is not death of the heart muscle due to a blockage of an artery. It is death of the electrical conduction system of the heart. So what's hanging on the wall over there? A defibrillator. So what they do is you grab the defibrillator, hook it up, and if their rhythm's this, they will shock it and they will become defibrillated. And the sooner you do this, the better chances they are of surviving. That's why when someone goes down, the first thing you do is you grab that AED and just start shocking them. And then if that doesn't work, just start shocking the people who are trying to help you. Hey, want to get shocked? See, just so you know, if you're touching someone and they're defibrillating them, right, and you're touching the person that's getting defibrillated, then you will need to get defibrillated.
If it's like that, are they gonna have a pulse or how's that?
No, they will have no pulse. Right. So they will be clinically dead.
Once they're dead?
Yep. So
Why
if you,
can't I just go flat?
there's still a little life left in that ventricle. And what actually defibrillating does is it resets the electrolytes. So if you've ever seen someone defibrillated, they're in ventricular fibrillation, when they actually defibrillate them, there's a flat line. And then the hope is that the electrolytes reset and then resume their normal activity. I had to defibrillate a lady 18 times. 18 times. The family would not make her a DNR. She was 85 years old. They had her go through heart surgery. She was in the ICU for 6 months. No one ever came to visit her. So I'm taking care of her one night, and she's going downhill, so I got to shock her. And then I call the family. I'm like, look, you better get in here. It don't look good. So they come in, and the son comes in, and I'm shocking her, right? And the paddles burned her flesh, so she had burns where I was defibrillating her. And then the son goes, you wanted me to see that. I said, you wanted your mother to live. My job is to make sure that she survives, and I had to do that. And I want you to look at her chest, right? I'm frying her flesh. You could smell the burning flesh, right? And they said, do whatever you can. And they never came to visit that lady.
Quick question. If you were touching somebody that was being defibrillated, what would happen to you?
You need to get defibrillated then.
Oh,
Yeah. That's why anytime you're messing with electricity, they always tell you to use your right arm. Because that current will take the path of least resistance. If you're doing it with your left arm, it will go through your heart. So if you're messing with someone like you got nothing to do and you're sticking a fork in an outlet, just make sure that you do it with the right hand.
I heard you have to put it in both the holes for something to happen. 'Cause my son did that. I almost had a heart attack.
If
Nothing
he's
happened with a screwdriver, like a small one,
he did that,
if he did.
I used
I
to always
don't
want
know
to
how
put
far he
coins
put
in
it.
there. They look like little coin slots. Remember those little the little springs that used to stop the doors, and then you'd hit it and it would make that.
Oh, yeah.
I remember as a little kid, I'd
My
hit
baby's
that and I like,
crazy about those.
yeah, and then I crossed my eyes as the thing was going back and forth. I'm like,
Yes,
wow,
my
this is
30
weird.
minutes just doing it.
This is weird. Yeah, it felt like I was on Quaaludes or something.
What causes you to pass out if you're being electrocuted? What causes you to lose consciousness?
When you're electrocuted?
Yeah. It happened to, when I was a kid, I got on this electric bed, there was a dog and I just reached down and picked the fence up off his hair that was stuck to him. And I didn't know, I was too young to know about electric fences, and it got me, so I stuck my other hand down to get it loosened. And I was unconscious, they found me that way, stuck to the fence.
I don't know. It could be sudden, like an arrhythmia that caused lack of blood flow to your brain, or it could be the the electricity just kind of short-circuited your brain for a second. But yeah, ugh.
That
When
explains
someone
a lot.
when someone gets the electric chair, explain what happens like to the brain or heart?
Basically, with the electric chair, it is you upset the electrical conduction system of the heart. As far as their brain, you're basically like if you've ever seen anyone get electrocuted, well, let's try it. What happens is when they're getting electrocuted, you're sending that electricity through their body, so they go into ventricular fibrillation. But at the same time, you're sending massive electrical current through your brain, and your brain is just a bunch of nerves that send electrical impulses. That's why they seize. So momentarily, I don't know if they feel any pain or not, but it really works by just putting their heart in a ventricular fibrillation. Yeah. And that's weird. I don't know, right? Lethal injection. Like that one time, the guy couldn't be executed because he wasn't feeling good. They stopped the execution because he was sick.
You know, the case was invented by the physician, right? He thought he was being humanitarian. The old ones, like, they weren't as quick.
Yeah, those things were good. I always wondered if you got your head chopped off and it fell into the bucket just right, that it's like you could see blood spurtulating out of your neck. You ever think about those things? Mm-hmm. No, you know what you think about? Reading the textbook, don't you? All right. Okay, did I do that? Hang on. I can't even see. Hey, here we go. Explain the concept of rate pressure product and why is that important in the management of CAD. It's important because you want to reduce the workload on that heart. You got me? Because the more the heart has to work, the higher your heart rate, the higher your blood pressure, the more oxygenated blood it requires through those coronary arteries. So if you have plaque buildup in those coronary arteries, then you want to reduce that rate pressure product. That's why you're given beta blockers. Because beta blockers decrease your heart rate and the force of contraction of your heart. Say yeah. Yes or no?
So rate pressure product is the amount of oxygen that the myocardium needs. And it's heart rate times systolic blood pressure. How exactly do we need to explain that?
That's all you really need to explain. Right? But in people with heart disease, you want that rate pressure product low. Do you understand? That's why people, they can have a heart attack if they're scared. Because what happens to their heart rate and blood pressure when you're scared? So if you have blockages in your coronary arteries, you cannot, when you're scared, deliver enough oxygenated blood to the heart muscle, and they can actually have a heart attack and die right there. That's why the little old lady, right, and she thinks the Hamburglar is in her house, she can have a heart attack as a result because she gets that rise in epinephrine. Say yeah. All right. Okay, I'm going to show you one more thing and then you can ambulate home. You guys are not paying attention. I can tell. Who's paying attention? You guys are all. It's warm in here, huh? Okay. Next time for Thursday, I'm going to bring some sand in and then we'll have like a little beach party. Okay? Bring some of those big beach balls and some Corona. That's what I was drinking yesterday. How many people drink beer? All right. Who else? That's it. Gita, do you drink beer? Gita's a wine drinker. Do you drink wine, Gita? Do you drink it all? Oh, how do you live like that? How do people live like that? Oh my God. All right, here we go. Ready? I'm going to explain this to you real quick. This isn't even on the test, but I think it's important. So you'll definitely remember it. I wish there was some way, like, if I made this class extra credit, everything was extra credit, you guys would be like Rhodes Scholars. Okay. All right, hang on. Okay. Here it is. Here it is. Watch. Remember I showed you? Here's the baseline. You got me? The ST segment should be at its baseline. So this is the ST segment, and here's the baseline. So it's at the baseline. You got me? In people who lack blood flow to their heart, they're ischemic. And how you detect ischemia is you will get what's called ST segment depression. Here's the baseline. Look at the ST segment. It is below the baseline. So ST segment depression indicates ischemia or lack of blood flow. Tell me you got that. All right? Listen up. Oh, here we go. ST segment elevation is a sign of complete obstruction of that coronary artery. You're going to have a grabber. Tell me you got that. So if you look again, and I'm not going to make you cardiologists, in 20 minutes. Here's the baseline. Here's the ST segment. It's elevated. And that is a sign that the coronary artery is completely blocked and you are going to have a heart attack. That part of the heart muscle, if that blood flow is not reestablished, that part of the heart muscle is going to die. Tell me you got that. And they call this ST segment elevation with convex blowing. It looks like somebody's taking the ST segment and blowing it up, right? Also, it's called the fireman sign. So this looks like a fireman's hat, right? There's his badge. Or they're called tombstone T waves. You've heard of this? Never heard of it? So this is very bad. And if this person, if they're not given medicine to reestablish that blood flow in that coronary artery, that part of the heart will die. Say yeah. ST segment depression, lack of blood flow, ST segment elevation, complete blockage of blood flow. Yes or no? Can I tell you a real quick story and then you can ambulate home? Watch. 1987, December 22nd, 1987. I know the date, because that day I was taking a flight home for Christmas, right? And I was working day shift. And about 1 o'clock in the afternoon, a lady comes in. She's probably in her 70s. And she's like, I don't feel right. And I looked at her, I go, what do you want from me? I'm going home. Leave me alone. So I get her blood pressure. Blood pressure's kind of low. And then I hook her up and I get a 12 lead. And I see this. So I yell to the ER docs, better get your fatty acids in here. So I'm giving her medicine. And even the ER doc is like, would not leave this lady's side. Anyways, we stabilized her. And then I was sending her up to the ICU. And she looked at me and she said, Tim, will I have to spend Christmas in the hospital? And I said, no. And she goes, oh, I'm so happy about that. And I said, yeah, you won't. So she got up, and then I come back to the ER, and about 15, 20 minutes later, I don't remember exactly, I hear code 4 ICU. And I call up the ICU, I go, that was my little lady I just sent you. And they go, yeah, she just died. That's right. I knew she was going to die. She had complete blockage of what's called the left anterior descending artery, the widowmaker, and that affects the electrical conduction system of the heart. And she went into ventricular fibrillation and died. So that's bad for you. How you prevent that is by reading the textbook, right? You'll never get a widowmaker. You maybe get hit by a truck, but not a widowmaker. Tell me you got that, guys. All right, so remember Thursday, don't bring anything to drink or eat. Get up a little earlier, right? Have some breakfast, maybe a bowl of Fruity Pebbles. Say yeah. And then, let's see. Finish up. Hold up, I'm going to give you a date.
I did send you the video. I don't know if you're able to get it.
I haven't looked yet. Okay, so today's the what? What's that say? The 19th? Oh, do we have class on the 5th?
Yeah,
We do.
I just want,
You want,
yeah.
we don't come in.
That'd work out nice.
Well, I can't give you the quiz that Thursday. Because you guys are going to come in smelling of bourbon. Going to be all liquored up, right? Staying up late. Did you see the fireworks? Ah, I just got home. How about that'll be plenty of time, the 10th. Yeah, that's plenty of time. If you don't do good, I'm going to mark your whole life wrong. Plenty of time. You got me? And then you can enjoy the 4th of July at least a little bit. Maybe stay up till, I don't know, maybe 8:30, 8:45.
What are you gonna be doing? I think that's more of a your excuse thing.
Yeah.
Like, hey,
For us.
blame it on us, like you guys are
I'm
gonna come
getting
in
looked
drunk.
at.
But it's really you.
Oh, I'm not drinking.
Yeah.
4th of July?
Yeah, I don't drink any more or any less. Always the same amount. Get the same buzz every night. All right. Did you
So
turn
that's
in?
Is that in 3 weeks?
Yeah, that's it.
Is it 3 weeks?
No, it's
Oh, is
two.
it two? Oh, 2 weeks. No, next
No, that's actually 3 weeks. Oh, wait, is that?
Yeah, but we still have
We put it in our
questions that are
calendar,
not
so
answered.
Hang on.
It's already.
Oh, wait a minute. Wait a minute. Wait a minute. Wait a minute.
Trust me, it's
I
all
just
right.
sent a
Everyone's good.
group text to the
Don't even
entire
look
class,
into
so
it.
everybody's
Yep.
already said.
Everybody-
All right, so on Thursday we're going to go over some stuff, and then on the following Tuesday we'll finish up. Right, we're not going to get it all. Yeah, and then the following Tuesday we'll finish it up. So you will have, yeah, you'll have 2 weeks. Look,
We're not complaining.
Thank you, yeah.
I need a big effort. Say yeah. All right, that's fair. Yes. Just so you know, the respiratory quiz is going to, or no, as soon as listen up. Oh, I'm glad we did that. That'll be Tuesday, the 10th?
Yeah.
Okay. The 17th will be your midterm. Now, watch. It's all the questions from quiz 1, 2, and the cardiovascular quiz. So it's review. It's not like you got to learn new stuff. Say yeah. All right. What? Is that okay?
Which is the 17th?
17th. So we'll pick times on the 12th.
Is it already up, like all the questions are?
Yeah, the midterm's posted.
There's like 24 questions, right?
Something, I don't remember.
Oh, really?
Yeah.
When is that next one?
The midterm's the 17th.
A week after?
Huh?
A week after?
A week after it. Say yeah. Okay? And that respiratory quiz is going to come quick. Tell me you got that. All right, go home. Go drink some water. I'm warm too.
Yeah, there's one.
Oh, there's 31 questions.
Oh,
31.
you guys will complain if a brand new truck ran you over.